not to like keep talking about Republicans, but this one, I kept seeing this thing pop up in my social media about somebody at the RNC convention that it looked like they had bad plastic surgery, or they said they looked like the Joker, and I was like, what is this all about? So did you guys hear about this guy, Matt Gaetz?
No.
No? I kept seeing it pop up, and probably because I follow some plastic surgery stuff, so when something, is out there, it tends to like trickle into my feed.
Yeah.
So I don't know who Matt Gaetz is. Apparently he's a Florida congressman.
Florida.
Yeah, Florida, right? He's probably going to one of those places.
Gosh.
So anyway, so this is about Matt Gaetz and his Botox problems. Yeah, there he is.
Oh dear.
Yeah, I know, right? So when I heard about this, I had to pull up the pictures, and immediately when I saw the picture on the right, I was like, oh, yep, that's a problem. So throw up that next one, Charles. I think I got a little bit closer picture without the words on it. Yeah. So I guess, that's his normal self there on the left, and on the right, that was him at the convention. I guess he was speaking. I don't know if he was speaking or if he was just doing an interview or what. So
he already has very pointed eyebrows anyways.
Yeah. So when I look at this,
didn't need to have that much.
I know. He does kind of look like the Joker though, doesn't he?
Uh-huh.
Yeah. So you guys probably know as well as I do what this is, or maybe don't. I mean, to me, it looks like that he's had Botox, and they gave him a pattern that I would typically use for a woman. Most women like the arched eyebrow look, and looking at you, Sarah, which I couldn't remember if you had arched eyebrows. Your eyebrows are not that arched.
No, yeah, mine are super straight.
Yeah, a lot of women will manicure their eyebrows to have that arch, and so when I meet someone for the first time that's going to have Botox, a woman specifically, I say, hey, look, the way I normally do this Botox pattern could arch your eyebrows. Is that something you would not like, or are you concerned about that? And most women say, no, I'm not concerned about that, because they actually like the arched eyebrow look. The only exception being people who already have really arched eyebrows. Like
It'll make it look too wild.
If they manicure them really aggressively, then the Botox can
make you look like the Joker.
Yeah, you look like the Joker, right? I've had one or two people over the many years that came back and said, yeah, it's a little bit too much. And so for most women, though, a little bit of arch is okay. And I think if he was a woman, people would probably not be talking about this, but it looks really odd on a man.
It
and
does
so
look weird.
It brings up the question of, okay, well, what happened to this guy? Well, I don't think that they really thought this through. There's a lot of people out there doing Botox, and maybe they don't necessarily think about things. Plus, not as many men come for Botox, so that means they're probably less experienced with it. Like when I do men personally, I give them two options. I say, look, I'm going to break up the lines in the forehead right in the center, but I'm not going to go out too far, because that will affect the eyebrows arching. Or the other alternative is to do a really aggressive approach, which would give you a more frozen look with less movement, but it would drop that outside part of your eyebrow. And I would say of the people, and I do Botox still. We try to have our med spa people do it, but there are people out there that say, oh, I want to go to the doctor, or people like you and my friends who want it. I'll still do yours. But I do have some patients that actually prefer not to have the arch eyebrow look at all. And so for them, especially if they're women, I'll pull that Botox all the way out here to the sides.
Yeah.
And they have a little bit less expression, but it's not a frozen look.
Okay.
But their eyebrows don't arch.
Okay.
And so I just think that he got kind of in that middle ground where enough Botox was given that it affects the eyebrows more towards the center and not on the outside, and then you end up with this.
Yeah, the top of his eyebrows are very pointed.
Yeah, they're naturally pointed, and so when this happened to him, to me it does look unusual. I mean, you could fix that immediately.
It made his eyes look really small. Didn't it?
Yeah, maybe a little bit. Throw that picture back up.
Look how small his eyes look.
It almost looks like an AI picture, to be honest. I swear that's the real picture. I pulled it off one of the big websites.
Poor guy. He was just trying to look good for the
It
convention.
might be a Megan Fox phenomenon where the lighting or his makeup just they're just not flattering.
Yeah, he
I
was
don't
just
know.
trying to look good.
He's probably a super nice guy. I feel bad picking on. I'm not like picking on him.
And he was trying to open his eyes like this.
Yeah, right. But he probably can't open his eyes very well because
because of the
is too strong.
Botox.
Me being kind of familiar with him, he's not like a super nice guy.
Oh, he's not?
No.
Oh, how do you know him, Charles?
I keep up kind of like politically a little bit.
Oh, okay.
He's like he's on the seat in Congress.
Yeah, I know he was a congressman, but there's
Yeah.
like so many of them. I only know the ones that hit the news. Like I know like mostly I know the ones that are really talked about the worst. Like there's the two Republican girls that everyone makes fun of, and then there's the AOC girl.
Of course. His
So-
eyebrows look diabolical.
He does, man. He looks like a
He looks like he's
supervillain.
He
scheming.
does.
A
He
supervillain.
definitely
Scheming
does.
for something.
Well, anyway, like I said, I'm not picking on Matt Gaetz. I don't know anything about
Not
him.
at
So,
all. Not at all.
But I wanted to kind of do just a little bit of a dive in here, and we've danced around this segment before on various things. But like, what can go wrong if you get Botox? And it's something that Sarah, we probably talked about this, you and
Yeah.
I, at times when you've come in, because I do kind of go through this with my patients. So, I guess the first thing would be is you don't like the look of what the Botox does. And I got another pic. Throw that next pic up there. And this is kind of the same thing where this girl had some arched eyebrows, and then they did a particular pattern and didn't relax the muscles way out to the lateral part. And then, you get this super arch.
Yeah.
And, this person was not necessarily happy with that. So that's an easily fixable problem. And, if I do a person and their eyebrows get too arched, I just bring them back and I put like an extra dot out to the side and you can solve it. But this is a potential issue with Botox, is they do the pattern and it leaves you with a facial expression you don't like.
Yeah.
That's an easily fixable thing. A lot of it can be avoided by talking to the patient ahead of time. And so if you're thinking about going and getting Botox for the first time, or maybe you've gotten and you weren't happy with like how the shape of your eyebrows were or something else, talk to your injector and say, look, I'm worried about this. Can you tell me about it? And if they say, yeah, I can tell you about it, then you feel confident that you're okay. But if they're like, well, what are you talking about? Then you might want to like find somewhere else.
Yeah.
Another thing with Botox is it may not work.
Okay.
Botox is very kind of persnickety. It has to be kept at a certain temperature once you reconstitute it, because it comes in like, it's almost like the individual Botox molecules are like just in this vial that looks empty. It's almost like dust, and you reconstitute it with saline. And once you do that, it has like a kind of a limited lifespan. If it gets too hot, it won't work. And sometimes I've actually even got a Botox vial that was bad. I mixed it myself and I injected it in someone, and they came back in a week. They're like, yeah, there's nothing happening. So one of the things with Botox is it may not work. Most of the time that's due to like a storage issue.
Okay.
So if you go to a place and
It doesn't have to do with like a person. Do some people
I mean,
just
it
not
could
work
if
on
they
people?
potentially drew it up wrong, like they miscalculated the dose, then you might get like a really weak effect. There is a little bit of intelligence needed to properly constitute the stuff and store it and inject it. I mean, it's not idiot proof.
I wouldn't think so.
Yeah, I mean, it is a procedure.
I wouldn't want to be responsible for putting that in somebody's face.
Yeah, fortunately,
Big
it's
responsibility.
yeah, it's mostly it's not really medical risk so much. It's more
Just like if you like it,
being
customer
unhappy.
service
Yeah.
part of it.
Another risk is if you get an asymmetrical result. I got a picture of that. Charles, throw that up. It's mostly an eyebrow. See, that person's eyebrow on the right still has, or her right, our left, still has some lift to it. But the eyebrow on her left, our right, has been basically let down. And so she's got asymmetry. You can fix that, but the only way to fix it is to
Inject on the other side.
yeah, you got to let the other side down too. Yeah, that's an injection issue. If you inject it properly, and you inject it in equal amounts, you shouldn't get something like that. I can't say I've never, in my however many 17 or 18 years of doing this, had an asymmetry. I have. I've had one or two over the years. That's easily fixable. If it happens to you a lot, then you might question your the person doing it to you. The next one would be Botox migration. I know we've talked about this. So Botox migration is where you inject the Botox in one spot, and the effect of it travels further away than you wanted.
Okay.
And so the big one is when the Botox gets into the eyelid and you get an eyelid droop.
Ew.
Yeah, I got a picture of that because that really is very, very noticeable. So
Oh dear.
Yep. So on the picture on the right,
Her
the
eyes
screen,
are huge.
yeah. So she's in the picture on the right. She's trying to open her eyes as wide as she can.
Okay.
And you see the one eye on her left, our right, is really, really open, but the right one looks like she's sleepy.
Yes.
That's classic eyelid ptosis, or basically paralysis. Fortunately, it's not necessarily harmful. It just is super annoying, and you look like you've had a stroke for 3 to 6 months, depending on how much Botox.
That
got
you
there.
can't really fix that one very easy.
No, not really. No.
Oh, gosh.
This typically is an injection issue. When I do Botox, and one thing I've been told by people who go to different places is that when I inject Botox, I do more sticks, which I guess on one hand is downer because you don't want to get stuck with a needle more times than you have to.
Yeah.
But the advantage of doing more sticks is you're putting smaller doses in more locations versus putting one large dose in, which then has that ability to maybe get away
Spread
from it.
out, yeah.
Yeah. So I like to use smaller doses in a little bit more stick pattern. There are pros and cons to it, but I do think that the results you get from it are probably the best.
I'd rather have more sticks than
Yeah.
a droopy face.
A droopy face. It also tends to make it very smooth, if you do that versus, it's precision, right? Precision is all about like small actions, not some big action. In very rare cases, there have been reports that people have a difficulty with their vision or swallowing, or even breathing if the Botox really gets away from you. I've looked it up, and I haven't found anything really serious about that. Like you hear about this, but it's like you hear about it, but you're not really sure if it happens because I can't find like an individual person that it's happened to.
Yeah.
Remember we had that fake Botox story though. Remember the fake Botox was getting away from people, and somebody actually had to put on a breathing machine. The last thing I'd say is anytime you're getting stuck with a needle, bleeding, bruising, swelling. I tell people honestly that at least in my patient population, the biggest risk of getting Botox is you get a bruise. And that's not related to the Botox, that's related to getting stuck with a needle.
Yeah.
So, did you bruise when I did yours?
I got one a little bit right here whenever
Did
you
you?
put it right here.
Yeah. It can happen.
It wasn't really that
Well, not
noticeable.
And plus girls can put makeup over it, so that
Yeah.
makes it nice. Yeah, the thing about that is obviously when any good injector is injecting Botox, they're not going to put the needle through any blood vessel that they can see, but the problem is the ones you can't see.
Yeah.
There's plenty of small blood vessels in the skin, especially and some in the subcutaneous fat tissue or even the muscle that you're not going to be able to see, and it's just kind of a luck, right? If you hit one and it bleeds enough, you're going to get a bruise.
Yeah. It wasn't very big.
Yeah, but they tend to go away. So, but yeah, that was interesting. Matt Gaetz. Hey, honestly, cheers to him for getting out there and getting Botox. I think it's cool. I haven't done it yet. My office manager keeps hounding me to get Botox.
You should do it.
I may do it just once and just see. Honestly, I'm pretty just lucky genetically. I don't have that many natural wrinkles, but I've noticed that I'm starting to see a couple. So I may try it. Honestly, I may try it just more for the entertainment value and to see if I like it. Not because I'm like, oh, I need to go get it. I like to do the lasers and stuff. That's my thing.
Yeah.
That stuff works really, really good. You'll have to try one of those sometime.
Okay.
Yeah, we can
I'm
do one for you.
interested.
We could actually do it, and we could do one and like video it if you want.
Okay.
We don't have to. I don't want to put you on the spot.
I don't care.
It'd be like free laser.
I'm used to videos.
Yeah.
Cameras
All right.
in my face.
Botox issues. Yeah, if you have any questions about Botox, bad effects, if you ever had a bad experience with it and you want to talk about it, that'd be interesting. I'd love to dive into that. So reach out to us if you have any comments on that. So.